All right, I think it's 8 p.m. and we'll get started with this webinar. Good evening, all. My name is Joji George. I'm engineering portfolio leader for GE Healthcare Digital. On behalf of GE Healthcare and the Hackerearth team, I'd like to welcome all of you to this webinar. The topic for this session is digital technologies for smarter and healthcare India. So in this webinar today, we will cover at a very high level overview of GE Healthcare company, the solutions and our engineering divisions that we have in Bangalore. We will also look at the healthcare system in India, the key problems and the big opportunities for digital disruption. We'll also look at the digital solutions available from GE Healthcare, which are transforming the way care delivery is done across the globe, including some of the solutions that we have in India. And finally, we'll touch base on the 3 innovation projects. Those are open under the GE Healthhack program. I also have Manoj Kaushik along with me on the call. He is a global product manager with GE Healthcare Digital. He will be active in looking at the different questions that you may post. So anytime during the presentation, if you have any question, please use the chat option to post your queries. In the second part of the webinar, we will be looking at the different questions posted and we'll try our best to answer them. So let's move to the first segment, which is about GE Healthcare. So GE Healthcare is one of the units of GE, General Electric Company, and GE Healthcare provides transformational medical technologies and services that are shaping up on new age of patient care. Our expertise in medical imaging, digital medical diagnostics, patient monitoring systems, performance improvement, drug discovery, and biopharmaceutical manufacturing technologies are helping clinicians around the world reimagine new ways of diagnosing and treating diseases like cancer, heart diseases, neurological diseases, and other conditions much ahead of time. Company is headquartered in US. It's a 19 billion unit of GE. Worldwide, we have more than 53,000 employees, and close to or even more than $1 billion is spent on R&D every year. Core strength pretty much in biosciences, technology, and business. And we are here with the purpose, and that's improving lives in the moments that matter. Now let's look at what are the different product portfolios are under healthcare overall. So it's a wide and vast product portfolio to start with. Healthcare imaging, this is about the different types of diagnostic imaging devices. You may be familiar with terms like CT, computer tomography. So this is used for scanning patients to find out any problems with they have from an accident or trauma and things like that, and also for cardiovascular diseases and brain injuries, etc. The imaging also cover the molecular imaging side of it, which means the PET and NM scanners, MRI machines, the interventional cath labs, which is used in cardiovascular disease diagnostics and treatment, mammography scanners, the X-ray machines, the surgical C-arms, etc. So these are the broad category of product that comes under the imaging portfolio. From a clinical care solutions, these are pretty much covering the diagnostics and treatment aiding systems which are used in the hospitals and ICUs and operating theaters, etc. Mainly the anesthesia systems, the ECG machines, maternal infant care, incubators, warmers, phototherapy machines, fetal monitors, and other patient monitors. Those are used in ICUs and NICUs, etc. It also covers the different types of ultrasound machines, used in point of care, like the handheld picture shown pretty much in this the slide itself. The scanners used in urology and cardiac imaging, etc. From a healthcare digital standpoint, which will be much interesting to the crowd listening in right now, we have a lot of solutions serving the enterprise imaging, starting with picture archive and communication systems, workflow solutions for the radiology department and cardiology department, and enterprise workflow solutions. Advantage workstations which handle 2D, 3D, and 4D processing of images. Collaboration tools like Case Exchange, and different solutions towards workforce management, pretty much staffing, scheduling, patient classification, HR, payroll, etc., as well as solutions for care delivery management, which includes electronic medical report, outcome and quality management solutions, perioperative and perinatal solutions from the digital portfolio. We also have a cloud solution, which I'll be covering in detail in one of the upcoming slides. Solutions using or around population health management, the Paradigm portfolio, as well as we have solutions for financial management at a very high level. From a medical diagnostic side, it provides solutions towards contrast media, which are used in diagnostic imaging scanner. Classic example is OmniScan, and these are used using air MRI or PET scans to find out abnormalities within the human body. Life sciences, that particular division focus on research tools, discovery and development, and bioprocessing areas. The research tools are something similar to protein research tools or DNA research tools, and cell imaging, microscopy, and tools for laboratory filtration. From a discovery and development standpoint, the product includes drug discovery tools, cell therapy processing, and process analytic tools mostly used in the pharma industry. And bioprocessing products pretty much enable pharma companies to reduce the cost and improve productivity while in full-scale biomanufacturing. Healthcare partners, this is a management consulting arm of GE Healthcare, a team of consultants working with our customers and their organizations to manage interdependencies between cost, quality, and access. So very high level, this is like a quick introduction about GE Healthcare itself. Let's quickly move on to the R&D division that we have in Bangalore. So technology and medical innovation division is one of the biggest R&D division for GE Healthcare globally. Our office is in John F. Welch Technology Center, Whitefield, Bangalore. We started this engineering division back in early 90s, and it's grown up to 1,800 plus engineers and scientists. All of them are working on different products and solutions in the healthcare customer base. Over the years, we have delivered more than 100 plus products serving global and regional markets, and we have secured more than 350 patents thus far. This is a mini GE Healthcare in all essence, with a true startup mindset. So in case if you are passionately looking for a career uplift, this could be a good place for you. Let's move on to the next part of the presentation, and that's about healthcare in India and the different data that we see from the different bodies, including World Health Organization. So interestingly, healthcare in India is a pretty big business. As you can see, it's more than 100 billion business in 2016. And the projection is that it will grow to 280 billion plus by 2020. So it's in 4 years, the growth rate close to 23%. Workforce required, we don't have enough healthcare providers, healthcare personnel. It's going to be doubled in the next 5 years. So from a 3.6 million base to close to 7.4. And this is also in order to meet the WHO guidance of 14 healthcare providers per 10,000 population. From a spending perspective, India spends close to 4.7% of GDP on healthcare, and the public healthcare expenditure is actually much lower. It's just 1.4% of GDP. And comparing the different countries, this is like one of the lowest one globally. China is about 5.5% of GDP, and US probably the topmost with 17.1%. There are few factors, going to impact positively on the healthcare sector. One is on the rising income levels, especially in the middle class. Aging population, life expectancy in India has been on a growing up mode for a long time now. Improved healthcare awareness, and also the change in attitude towards preventive healthcare. And these factors are going to boost this industry in the upcoming years. As we all know, the private healthcare, that's like the biggest play here, and that accounts for 74, so like 3/4 of country's total healthcare expenditure today. I know it has got an economic factor, but more than this is basically the sector talks about the health of the nation. So from a government standpoint, this attracts a lot of discussions, urgency, and also spending plans from both central and state governments. From an infrastructure standpoint, we lack infrastructure in a big way. If you want to meet the world median of 2.1 hospital bed per 10,000 people, so 1,000 people, we'll need another 7 lakh hospital beds in the next 5 years. So that's about another $30 billion investment that needs to happen on this as well. Continuing on this thread, the Tier 1 cities have better access to healthcare, while it is not that case for the Tier 2 and Tier 3. There is a lot of demand for high quality care and also access to specialists in this case. Telemedicine has been an emerging topic. It has been seen as one way you can bridge the rural and urban divide in terms of medical facilities, consultation. The specialist could help the semi-skilled labor in the rural area through the ways of telemedicine. Increasing spread of internet has been helping on this side as well. Mobile-based health delivery is been picking up speed. This industry is expected to reach $0.6 billion in this year. From a statistics perspective, we are not doing that great. So infant mortality rate, we are at a number of 40 today. So this is about the number of kids that they die out of 1,000 live birth. Our neighboring countries like China is at a number of 12, which is much better than India. Interestingly, countries like Sri Lanka is at 8. Most of the developed nations are in like single digit. Africa is like pulling the number pretty high, more than India. So this is surely an area of concern from an India healthcare standpoint. Another metric is the maternal mortality rate. We are at 174 per 1 lakh live birth, which is we are pretty close to the median again. Countries like Africa are pulling this number down from a statistics perspective, and our near neighboring countries are actually having a much better figure. So this is also an area of improvement from a country standpoint. So moving on, what are the big issues when it comes to the healthcare? So one of the number one issue from a India healthcare standpoint, limited availability of healthcare professionals. We are at a ratio of 1:1,674, where the World Health Organization norm is 1:1,000. So we are really lacking with respect to the norm that's set by World Health Organization today. We still observe a lot of death from the communicable disease, and we are much worse than the global average. That's a sad part. From a medical insurance standpoint, as we know, not many people in India have medical insurance. Only 20% population has it, and 60% of the medical expenses are paid out of the pocket. So the affordability also becomes a bigger question here. Another problem, as I mentioned earlier, too, the access to better healthcare in the rural India, the rural parts. Interestingly, more than 70% of population stay in the rural place, and only 3% of the specialists cater to this demand. So which is like a big gap as well. When you look at the digital disruption opportunities, lack of skilled care providers at the point of care is one of the biggest opportunity for us to influence and do disruption using digital technologies. There are, of course, other lacking factors: lack of infrastructure, lack of affordability in terms of payment side of it. There are some schemes are going to be introduced, or some are already introduced by government of India to kind of help people to gain access to insurance and things like that. Let's look at how the ecosystem in India overall with respect to digital and the different startups. So interestingly, there are a lot of startups being emerged in the healthcare space over the years. So the statistics say like more than 300 startups started in 2015, and a very good amount of investment that came in as well. 1.6 billion was the number quoted that was invested in the healthcare sector. Half of them actually went to pharmaceutical sector, but the rest were to hospitals, to devices, mobile health, home health, tele-health, analytics, practice management, etc. And if you are you dialed in from Bangalore, Bangalore is one of the main hub for healthcare startup, and the technologies companies actually secured 100 million funding in the year 2015. From an internet coverage and the infrastructure standpoint, this has been on a rising trend. We actually crossed US in terms of the number of people having access to internet, and we are just behind China today. And as you see the numbers going up in the year 2015, the internet coverage increased by more than 50%, and the last year it was increased by another 30%. So close to 1/3 of the population today have internet access, either through a broadband or through smartphones. And from a startup standpoint, there were a lot of companies looking at e-commerce side of it, so basically connecting the provider and the needy person in terms of care. A lot of startups on the telemedicines, some with respect to managing chronic diseases, some in terms of delivering the healthcare itself. Quite a lot of them for self-care and preventive care in areas where the startups were functioning. Let's also go to the next segment, which basically talks about the digital solutions. Those are transforming the way health is delivered today. And some of the examples from the global markets, and quite a lot of them are applicable to India as well. And the first one that I would like to cover is the GE Health Cloud. This is built on top of Predix, the industrial internet platform of GE. If you have not heard about Predix, I highly recommend you to go to ge.com or predix.io website. There are a lot of material which talks about this industrial internet platform, and it even gives a lot of access to some of the services from a developer community standpoint. Security is one of the important aspects of GE Health Cloud, primarily because of the reason that it deals with patient data and health data. Connectivity and interoperability is another big vector, because as you see in the previous GE Healthcare introduction slide itself, there are many types of devices, from diagnostic scanners to patient monitors to ECGs and things like that. All of them needs to create data in digital form, needs to be connected to the cloud. Then only any application can be developed to provide meaningful insights to our clinicians. So GE Health Cloud is kind of an answer to this problem from GE. A little more deeper look onto the Centricity imaging collaboration suite. So this is a scalable, secured, connected ecosystem. It starts with the hospital network. So you have patients and devices in the hospital site. It could be a CT scanner or an ultrasound scanner or a patient monitor. These gets connected to the cloud using the Health Cloud Gateway, which is IoT platform of GE Health Cloud. Once the data is available in Health Cloud. There are different applications and algorithms helping clinicians to deliver quality care in a better and efficient manner. It also provides an ecosystem for third parties to develop and deploy application on top of the GE Health Cloud. And as you could see the different mention about security, that is one of the important aspect the GE Health Cloud is bringing in. These are the different applications those are available on the GE Health Cloud. So Case Exchange is a collaboration software. It enables radiologists, referring physicians, and clinicians to collaborate each other on a particular case of a patient for a second reading, for additional opinions, or even just data sharing between a remote center and a main clinic. Multidisciplinary team meeting. This is basically allowing physicians to enable a better quality care in terms of care pathways like oncology, where before a particular treatment option is picked, the set of experts actually review the case of a particular patient, either in a physical room or kind of a teleconference or webinar type of meeting, and go through different aspects and make the best care recommendation. So multidisciplinary team meeting through cloud allows them to do this kind of meetings in a most organized and efficient manner. Cloud visualization enables the image manipulation, be it two-dimensional or three-dimensional, to be done through cloud. You don't have to have high-end compute. You don't have to be within the vicinity of hospital or clinic. You can do it pretty much from anywhere. Image access, it provides image sharing between enterprise and clinics and referral centers in an easy and efficient manner, so that you don't have to carry your image CD from one place to another. So saves cost and improve the efficiency. It also allows patients to get access to their particular data sets, which is basically can provide the longitudinal patient record for them as well. Healthcare Insights, this is our analytic platform. So the data could be from an operational side of it. Example, how a particular machine is getting used. So an asset performance management topic, or it could be on a financial data set, or even a clinical data set. And there are different types of connectors available to ingest data, and it supports variety of data forms. It could be JSON, XML, database as a data source. You could have bulk data being uploaded, or it could be even transaction-based data coming in as a stream. And it gives powerful analytics and reporting tools, which can be used by a person or like a data scientist to kind of provide interesting clinical or operational insights for the end users, which could be an operational person like a COO, or it could be a direct clinician who is responsible for administering care to a set of patients. So this could be kind of deployed either on cloud or on an enterprise on-premise mode. Moving on, the next one, just wanted to kind of touch base, and this is more connected to the India healthcare space as well. So this is about digitizing the ICUs. So if you remember, one of the big problems in the Indian healthcare is access to skilled care providers, especially in the Tier 2 and Tier 3 space. And this basically try to solve that. So you have many hospitals having even some sort of ICUs in Tier 2 and Tier 3, but they don't have enough intensivists who can manage those patients coming to the ICU. So this basically, this solution allows a hub and spoke model. So there could be a digital ICU hub in a Tier 1 city, and that's a place where this skilled intensivist is available, and patients could be admitted to the ICUs in Tier 2 and Tier 3. All their patient monitoring parameters, so whatever the machines connected to the patients will be transmitted digitally to the central hub. So those are monitored 24/7 by the skilled intensivist, as well as an audio video collaboration from the patient bed to the remote hub. So it's like a big cockpit kind of command center you have at the specialist end, where the specialist can monitor for all vital parameters as well as the patients. Directly they can see how they are doing it as well. This is like a solution that we have deployed in few places in India, and it's really helping remote places to kind of set up ICUs. In case of these kind of solutions are not available, the other way of supporting those patients today are actually transferring them, basically moving them from tier 2 to tier 2 or tier 3 cities to the tier 1 cities where the intensivists are available. So that costs a lot of money to those patients, and also it delay the care delivery to them. Also wanted to touch upon the InSite from a service standpoint. So InSite OnWatch is our analytics platform for machine service. So all the GE Healthcare equipments, be it a CT, MR, ultrasound scanners, are shipped with the agent software, which keeps monitoring the operating of that particular equipment and keep looking for different parameters, how healthy that equipment is functioning. And it sends the data back to the data lake where predictive algorithms are being run. And it kind of notify much ahead of a particular failure, be it a hardware or software that's going to happen at the hospital. For example, for a CT machine, it runs on X-ray tubes inside, and the tube has a definitive life. So some parameters captured from the CT machine basically send it to the data lake, and the algorithms can predict at what time those tubes will stop working, and it will send the tube replacement in advance so that the hospital can operate without any downtime. So before even the machine is going to go down, the parts arrive along with the field engineer support. So those are the service-related connectivity and analytics software those are serving, and also transforming how the hospitals operate today. Let me quickly move on to the next portion, which wanted to touch base on the 3 innovation projects. Those are open for registration under Healthhack. The first project is on video content analytics. So this is tied back into the digital ICU solution that I talked about. So it's about video content analysis. So the video would be just streaming directly from a camera which is facing the patient. The analysis for detecting any temporal or spatial events. So a few examples pretty much given on the right side of the slide itself. One, to detect are there any signs of distress that's shown by the patient. So it could be from the patient is undergoing some pain, and any software technology that can be used to analyze that incoming video to find out if the patient emotion is in a good emotion or is under distress. So that's like one of the features of this particular project. Second is on a safety protocol implementation. So look for big movements, and it could be maybe because the patient is moving alone. That could be a sign for something, or it also could detect a fall, or even it could be prevented. Patient identification is another one, especially in the neonatal space when small babies are being monitored. So from the face of the patient, try to match whether it's the same patient as it was earlier, or if the patient that should be monitored in this particular ICU bed. And a tripwire, that's about, again, watch for any movements within some boundary conditions. So it could be that an unauthorized visitor, which could be, that could trigger an alert to hospital personnel, or it can be also programmed to see whether the hospital persons at the remote end are making the number of rounds and visits as it's supposed to be. So in case if they don't do it, it can detect and send the trigger as well. So this is at a very high level about the video content analytics part of it. This project that we are looking at having this algorithm done and done in a way that it can be integrated to healthcare platform, which could be either on a cloud or on enterprise. For example, the solution is a digital ICU. Moving on to the next project, so that is on the contextual care protocol. An example use case, we'll probably go through that first. So this is more connected to mother and child care. So for example, a pregnant woman visiting the clinician, probably her second pregnancy, and the first and second being basically administered by two different doctors here. So the first case where the doctor looks at the patient, and of course she finds some problem, for example low hemoglobin, and prescribes some iron tablets just to correct it, and she don't have access to any of her previous information just because of lack of infrastructure out there, and doesn't want to add any other medications or tests to complicate this particular pregnancy period. And again, affordability also plays a big role here. So the pregnancy continues, and there is no alerts, and there is no information from the previous episode here. It could lead into some complications which could come as a surprise in the first case. Where in the second case, the second care provider, again the same data that she also have, low hemoglobin and iron tablets, that's standard care pathway for that. But in addition to that, this doctor finds that there was an incident of low blood pressure and also intrauterine growth retardation. Basically, the baby was not growing well enough as per the time progresses in her last pregnancy. So that particular alert makes this doctor to make note of this and also put some procedures, scans, and tests in accordance with this, so that those two conditions are monitored, the BP monitoring as well as the baby growth. Also, the system alert heavy blood loss during the last childbirth, so that alert is sent to blood bank and they make enough preparation if there is an emergency cesarean required during the birth, the blood and things like that available. So the second case, as you see, is much better quality care per se, and it would be possible only if we have standard protocols, care protocols, and there are systems by which it could be administered. So little more details on this contextual care protocol solution. The first part is basically to model the standard care protocol. So it can be seen as like a sample decision tree, starting with a normal, uncomplicated pregnancy, and it could go down to different cases and scenarios like high BP, sugar, anemia, etc. So based on the data entered by the physician, the system should select appropriate care protocol from the predefined model. And also it should allow the doctor to see how the history was, and also add and change some of the information that's been provided based on the observation the doctor see during every patient visit. That's like you have a model, tree structure, and traversing it and picking the best care protocol based on the condition given. The second piece of this project basically to introduce a bit of machine learning, because some of the situations where the model may not be exactly perfect. So the care provider may choose to follow a slightly different path, and of course for the right reasons, and he or she makes note of it. And the system should look at what are the deviations done by which all care providers and an approved person. So like a protocol modeler kind of a person looks at these deviations. And if these deviations ought to be kind of the right deviations to be taken in such patient cases, that knowledge is fed back to the model so that the model self-learns. And when such a patient or such a scenario happens later phase, this updated care protocols are picked. Again, this is going to help the infant mortality rate and the maternal mortality rate that I talked about in the previous slides for a country like India in a big way by standardizing the care that we provide to the pregnant woman. Moving on to the third project. So this is about contextual training platform. Again, hitting on the problem that we don't have enough skilled care providers in the rural India. Most of the times, these positions are fulfilled by fresh graduates out of the nursing or MBBS schools. And just because they don't have enough knowledge and experience, it is impacting the quality of the care as well as the speed of care delivery. They will prefer that to a senior doctor. They may be referring that to a tertiary hospital in a tier 2 or a tier 1 cities. Well, what we learned is they have enough appetite to learn, but they don't have access to meaningful resources. So the contextual training platform is trying to solve that problem, and it is through dynamically creating context-specific learning capsules. Again, there are a lot of information available on pretty much any disease that you can think of in the internet, and there are qualified websites like WebMD, NHS, NIH, and many to quote. So they have a lot of information already available, but it's like it's like a sea. I mean, you just cannot find what exactly that you want. So based on the current context, the care provider is operating on, and it could be the cohort of the patients that he has been attending to, or maybe a type of disease which is most prevalent in that area where the particular person is posted in. So take the scrap the data from the current practice management system, and we provide some data models towards it, and connect to the external sources and create relevant learning modules. Present that back to the care provider so that he or she can spend time on this platform and learn something which is relevant to the care that he or she needs to provide to. Some internal storage here would help because you don't have to go to the external system always. Once you create a learning model and index and keep it locally. Also, we are looking at the care provider to rate these learnings. Some of them may be very useful, some of them may be not very relevant, so that the system knows what to show the next time. So more rated learning modules get more access and more visibility, more rating, and also some sort of incentivizing this learning. So the clinicians get some type of rating and scores based on the number of modules that they cover. So basically just give them some sort of incentivization on how good their learning has been. So this is about the contextual training platform overall. So we talked about three projects up in the Hackerearth. One is the video content analytics. Second is care protocol standardization, and third is the contextual training platform. That's the end of my presentation, and we'll now look at the questions that have come in the tool. So if you have any questions, guys, on GE Healthcare, the technologies from a digital standpoint, or even the projects posted, please use the chat option to post your questions. Let me do this. So I'm just going through the questions here. Okay, I think there is a question from Santosh GSK. Do you provide supervised data for video content analytics? Yes, so there will be some data set available for you to test the algorithm, and it has to be some sort of anonymized video, because just for the fact that we cannot share real patient videos, etc. But for testing purposes, we will have some videos in which you can test the emotions and large movements and whatever the criteria that the project has been talked about. Okay, so one question from Ashish Mukhalkar. GE Hackathon, are we supposed to use GE Health Cloud to gain advantage? No, it is not a requirement. GE Health Cloud today is in its final stages of delivery, and given the fact that the Healthhack Day is coming few days from now, you don't have to do it on top of GE Health Cloud, but recommendation would be to pick technologies which will allow to run this on a standard cloud platform as applicable. You could look at can that be run on top of AWS or even Azure. Okay, one another question from Santosh. Will there be any data tagged and tag provided for the VCA problem statement? I think I answered that question. Yes, so we will have test data available. And if you would like that to be tagged for different cases, we could make that available as well. And I suppose this requirement is towards testing your algorithm. If yes, then yeah, we will have those test data available. Question from Jayant Ganapati Raju, will this recording be shared? I believe so. So the Hackerearth team members are recording this particular webinar, and it will be shared probably in a day's time, and you'll be able to access that on their website. There is a question from Swapnil Bhole. More idea about video content analysis. So yeah, I think I had one slide on top of what is the end need that we are looking at, what's the problem that we are trying to solve. If you have any very specific question, please put it in. I'll try to answer, or use the Hackerearth review comments forum, which are being actively looked upon by our experts, so we'll be able to answer any specific question that you may have. Are we allowed to use depth cameras to generate our own data set and test our algorithms? It should be possible, but please remember the problem that we are trying to solve. So it's all about video analytics and that video coming off of a patient or human being. I'm mostly looking for big movements around as well as on the patient bed and on his or her face. So if those parameters can be fulfilled using depth cameras or whatever, should not be a big problem. What algorithms and techniques are used to process data? This question from Manish Saraswat. Not sure I understand the question well. So if it is about the video content analytics, there are many open source tools, algorithms available to start with the facial recognition, etc. If you see, many of them are used by Googles and Facebooks and stuff like that. That could be a good start, but that's kind of the problem that we are putting up. So we are looking at the Hackerearth community to come up with innovative solutions in this space. Okay, another question from Anish. We would be requiring some videos to train our model for VCA. Are you planning to provide some videos? So a limited quantity of video we could make it available, but not in very high quantity, just because of the fact that real patient data and video we cannot make it available to general public, so it has to be bought. I think there were some pictures already made available in the Hackerearth website itself. Some sample videos to test which we could make it. In order to prune your algorithm, or you want to make your algorithm self-learn this in this process, that's something that we can explore. But since patient means just another human being, I mean, you could as well look at any public videos for this purpose as well. So something that we can help, or rather co-develop in this space. What are the different videos that could help in this space? So some videos for testing we will have, not a lot in quantity. What skills do you look in candidates while hiring for data science profile? Question from Manish. So it depends on which area that they are going to work on. The best way to know that would be to go to our public website, ge.com/careers, and you can literally search for the current job openings in India and as well as abroad. From a GE standpoint, not just GE Healthcare, and I'm sure there are a lot of jobs on the data science profile, and there will be details on what are the minimum qualifications required and what are the desired qualifications that they would look at. So I don't think there is any straight answer to it. I would refer to the GE Careers website for the same. Okay, I think these are the questions that I see in the chat for the time being. If you have any other questions which you wanted to ask but have not done, please put it onto the chat window or the question window. Okay, so this question is from Kaustubh Sakalkar. What are the existing features that GE Tele-ICU has? We don't want to build anything that is already there. So the project that was put up was purely on video content analytics, and that feature is not there on the Tele-ICU today. So the existing features include ways in which you can connect the different patient monitors. You know, when you look at an ICU, the patient will be connected with a lot of devices. So there are ways in which you can connect those devices to the patient and also extract that data and send it to the main hub, the specialist end. So that capability is available. There is already ways in which you can monitor the patient through an audio video system, and those video cameras could be remotely operated. So the specialist would like to, you know, zoom, pan, move the video at the tier 3 city. That can be done as well. And there are, you know, dashboards and cockpits which basically monitor the data coming in and sending alarms. And currently the alarms work based on the data that is acquired from the patient through the different types of devices. There is no alarm capability from the video that is coming in from the cameras. And the video content analytics, that's kind of a solution that we're looking at to kind of trigger if there is any distress or pain felt by the patient. Ideally it should send an alarm, or there are like big movements, so probably it should send an alarm. So the analytics part is something that is not part of the product, and that's why we put that as a project to do the Hackerearth forum today. Good question. The next question from Lavish Jain. My friends and I are planning to participate in GE Health hackathon, which is being organized in Bangalore, but team limit is 4 and we are 5 in the team. So is there any way that we all 5 can participate as a team? Okay, that's a good question. I don't know the answer to that particular thing. Lavish, would be great if you can post this query on the Hackerearth project website. I will have one of our logistic person answer to it if there is a reason why we kept the sizes 4. So sorry, but I just don't have an answer. So we'll get back onto the Hackerearth platform the answer to this question. Okay, we'll wait for 1 more minute for any other questions which are in the queue. Okay, I think, okay, there's one more question that came in. Will GE provide hardware for the hack, or we have to arrange our own components? I'm sorry, but that's another logistic question. I'll have this also answered on the Hackerearth forum. Most of the solutions that we put up are actually software based. So I would assume the compute is what probably that you would require, not in terms of a specific hardware here. But still, I'll answer that question on the website. So I just don't have an answer for it right now. Okay, so I think that's it from the different. Okay, there's one more question just came in. That's from Minerva Panda. Will GE provide any data set? I think that question depends on which particular project that you are interested in. So for a video content analytics, there will be sample data set which can be used to test your problem. Okay, so you're saying the problem number 2, the contact care protocols. So this basically is a tricky question because it's basically about creating the decision tree and the ability to traverse the tree to pick the right protocols for the particular patient in front of them. So minimum data set creation is actually part of that project itself. So we don't have like a big protocol database and you're expected to just create a tree to traverse it. So that's like only a very small problem to put up. There is a lot of public knowledge available, and the rating for this project number 2 will not be on how good or accurate that model will be, but on the capabilities the software has to traverse that particular tree and also to self-learn from it. So from a dataset standpoint, no, we will not have big data model given to you. That is part of the project making itself. Next question comes to Sankalkar. Can you make your video dataset available in the public domain in advance? Good question. I'll have to get back on this particular question. I think for surely we could make that available during the hack day, which is going to happen in the GE office. Ahead of time, I'll have to check with the logistic team, is it even feasible to do that? So then this will be the third question that I'll have to come back. And I promise that I'll put these answers on the GE, the Hackerearth webpage, maybe in the next working day. Okay, Minerva Panda, since there are so many diseases associated with pregnancy, can we just test with the 2-3 sample diseases for validating model? I think that's perfectly fine. Yeah, that space will lead to very complex equations. So starting with a sample data set of most popular conditions during pregnancy will be a good start. And the model and the software has to be extensible to add further disease conditions to that, so that we can take that to real usage later. At the starting, a few sample diseases will be fine. Okay, I think that's all the questions that has come in the forum so far. So I would like to thank all of you again for joining the webinar today. In case if you have any further questions, please feel free to use the Hackerearth website to post your queries. Some of our subject matter experts are looking at and they'll be responding to that pretty faster fashion. Thank you again on behalf of GE Healthcare Hackerearth team attending the webinar today. Um, that's it. I think with that we could conclude this session. Thank you all.